HvA Amsterdam is an early intervention service in the city of Amsterdam for patients with the first episode of psychosis. The focus of the service is to treat patients for their mental disorder, but especially is the main goal, functional recovery. We want to help young adults with getting a degree, learn a trade, and help them finding and keeping a job via the model of individual placement and support. Evidence shows that this approach gives a better prognosis for the long-term outcome.
Ja, 3, 2, 1. Take 1. IPS is a means individual placement and support. It's a strong working evidence-based intervention and we work with it in Holland for 6 years now in the early intervention team. The focus is the possibilities of the clients and intrinsic motivation. We look with the client, what can I do, what are my dreams, what are my goals in life, what I want to reach. So you talk about that in the beginning and also going on in the process. The special on IPS is the focus is working together with it's an integrated intervention. You work with treatment and rehabilitation in one team. So that give our clients more. They have more profitable for that approach. Because young people don't want to talk about illness. They not want to focus on illness. They want to focus on the possibilities and want to go on with their lives like their peers. IPS is also meaning that you have an employer's approach, development approach, and you're working also closely together with employers to make job opportunities and find a good fit for the employees. So
During internships of occupational therapy students, they're being trained to become experts in enabling daily, meaningful occupations like work, leisure and education. And it seemed that IPS and the methodology of working with the VIP teams is a good learning experience for students which contributes to their professional development and in becoming a competent occupational therapist. And it showed that occupational therapy can be of added value. And this might be because the principles of occupational therapy have a good fit with IPS. We work client-centered, which means that together with the client we assess their needs in performing daily activities like work, and we guide clients in their individual set goals and foster their own drive and motivation to maintain them. And secondly, we work occupation-based, which means that doing and performing activities itself is essential. And this aligns with IPS perspective on placing clients in an actual work situation. And thirdly, we work context-based and we create the conditions with the client by working together with them on the job and on the placement itself. And of course, we need to work evidence-based and use scientifically grounded interventions, which are grounded by research. So, practical placements are essential for the student's learning process and very suitable to learn and experience complexity of psychiatric primary care, working in multidisciplinary teams, networking with stakeholders, work providers and clients. And I think in the future, professionals after such an experience will be more skilled, more trained, more flexible and ready for the future challenges of occupational therapy in primary care.
I would like to tell something about my experience during my internship at VIP. Because the EPS model is the basic process from the SOT, we start to look which job will be successful and start as soon as possible with the client. After the first psychosis, the clients are always getting a disease awareness. When this happens, you are not only the therapist but also a friend, mother or sister they never had. In this way you can connect to the level they need. In my case report, I met a girl that didn't speak at all about her feelings or needs. I tried several ways to learn about her, and now she's much opener in speaking to my colleagues. This is the beginning of understanding each other and make the big steps forward. For me, this internship has learned me not only to connect better with the client to reach their goals, but also for me personally to communicate with stakeholders and owners of companies. I wish that EPS will be better known in the psychiatric settings, because I can tell you from my own experience that it is a good way to support client goals for work.